We have the pleasure today to be talking with Robert Kowalski, author of 9 books. He is an expert on heart disease. Heart disease is the #1 killer, right? In our
both
society?
men and women.
Men and women.
Both men and women, equal opportunity killer.
And some 400,000 people a year die of sudden cardiac arrest, which means they may be dead by the time they hit the floor, but absolutely never get to a hospital.
Yeah, actually the number might even be a little higher, might even be up to 500,000. Unfortunately, for too many people, the fatal heart attack is their very first symptom that they had anything wrong with them to begin with. And indeed, statistically speaking, 50%, half of all the first heart attacks are fatal.
Unbelievable.
My father was one of those victims.
What are the 4 major causes of heart death?
Oh, once upon a time, they used to call it the big 3: cigarette smoking, elevated cholesterol, elevated blood pressure. Today, most doctors are including diabetes as the 4th, and so it's now the big 4 risk factors for heart attack and stroke. When we talk about heart disease, it's really cardiovascular or cerebrovascular disease combined, that it's heart attack and stroke that are essentially the same disease, and combined take out about 50% of the population.
I understand that about 60% of the deaths that are actually caused by diabetes are attributed to other diseases, but diabetes is really a major problem, isn't it?
Well, diabetes is the underlying problem that then leads on to other kinds of problems that are exacerbated by the diabetes being there, the high sugar levels. And interestingly, with diabetes, when I first started writing 40 years ago about health and medical matters, the term for it was maturity onset diabetes. Meant that people typically wouldn't develop this problem until somewhere in their 50s or even their late 50s, early 60s. Today, they've changed the name to type 2 diabetes. That designates it from type 1, which is what you're born with, and you have to give yourself the insulin injections on a regular basis. Type 2 is really the result of overweight and lack of physical activity. It's really mostly a lifestyle kind of thing for 85% or more of all cases. And what we're seeing is that younger and younger and younger and younger people are developing diabetes, so that now they call it type 2 instead of maturity onset, because you can't call it maturity onset when the patient is in his or her teens or early 20s.
Now, is that also then being reflected in heart disease? Are we finding younger and younger people?
No question. I've been to several heart meetings just recently where physicians are addressing audiences of other physicians, telling them the cutting edge stuff to go back and use with their patients. And 3 different occasions, a fellow started off talking to the doctors in the audience saying, "Doctors, if you have a patient that presents with diabetes," that is, you now have found out that patient has diabetes, "if that patient presents with diabetes, you have a heart patient." It's just assumed at that point that the person, by the time the diagnosis is made that he or she has diabetes, that the beginnings of heart disease are already in place, and that you have to treat not only the diabetes, but actively go after the other risk factors, because they are in extreme risk of heart attack and stroke.